The Adolescent Health and Development Program, or AHDP, is one of the major programs of the Department of Health. The goal of AHDP is to promote the total well being of adolescents aged 10 to 19 years old. It is not only about physical health, it also includes emotional, mental, and social development. This program focuses on health education, empowerment, and responsible decision making, ensuring that young people safely transition to adulthood equipped with knowledge and life skills. The AHDP is guided by DOH Administrative Order 2013-0013, which outlines the National Adolescent Health and Development Strategy, or the PAHDS. It is supported by key laws such as the Republic Act 10354 or the Responsible Parenthood and Reproductive Health Act of 2012 and the Republic Act 11148 or the Kalusugan at Nutrisyon ng Magnanay Act. This program also aligns with SDGs 3 and 5, which aim to promote good health, well being, and gender equality among all individuals, including adolescents. The main goal of AHDP is to ensure that adolescents have access to quality, youth friendly health services. It aims to promote healthy lifestyles and responsible behavior, helping young people make wise decisions about their health and relationships. Another key objective is the prevention of teenage pregnancy, sexually transmitted infections, HIV, and substance abuse, all of which pose serious risks to adolescent health and future opportunities. The AHDP has three major components. First is health education and life skills development, where adolescents learn how to handle challenges and make informed decisions. Second, it establishes adolescent friendly health facilities that provide confidential, non judgmental care. Third, it emphasizes collaboration among schools, local government units, and youth organizations because adolescent health is everyone's responsibility. Now, what are the most pressing health issues among Filipino adolescents? The top main concern remains, such as teenage pregnancy. which affects education and long term well being. There is also this concern of rising cases of mental health problems such as depression, anxiety, and substance use among the youth. Lastly, STIs, HIV, and other risky behaviors continue to increase, particularly among older adolescents who lack access to accurate information or support. The AHDP stands on four main pillars. First, life skills education, which equips the youth with the ability to make sound decisions and resist peer pressure. Second, accessible and confidential health services, so adolescents feel safe when seeking care. Third, active youth participation, ensuring that adolescents have a voice in health programs that affect them. And fourth, a supportive environment, meaning family, school, and community must all work together to guide and empower the youth. Adolescent Friendly Health Services, or AFHS, are facilities designed to meet the unique needs of young people. These centers provide safe, private, and non judgmental care where adolescents can seek advice or treatment without fear or stigma. They offer counseling, reproductive health, and mental health services delivered by staff trained in youth communication and sensitivity. The goal is to make health facilities a place where adolescents feel welcome and supported. Nurses play a vital role in the success of the AHDP. First, we educate and counsel adolescents about topics such as nutrition, reproductive health, and mental wellness. We also facilitate peer education and community outreach, empowering youth and young people to help each other make informed health choices. And lastly, nurses serve as advocates, pushing for youth friendly, inclusive policies that ensure adolescents' voices are heard in healthcare planning. To bring AHDP closer to the youth, several strategies are implemented in schools and communities. We establish youth health corners and peer support programs in barangays and schools. Health educators integrate reproductive and mental health lessons into school curricula to increase awareness. And through parent youth communication sessions, we strengthen family relationships and encourage open, supportive dialogue about health and life choices. How do we know if AHDP is successful? Indicators include higher utilization of health services, increased youth participation, and declining rates of teenage pregnancy and HTIs. However, we continue to face challenges, such as stigma around adolescent sexuality, limited access to youth friendly services, and training gaps among healthcare workers. Addressing these barriers require teamwork, continuous education, and stronger advocacy. The Adolescent Reproductive Health, or ARH, is one of the main components of AHDP. It promotes informed and responsible sexual behavior, helping adolescents understand their reproductive rights and responsibilities. It provides age appropriate reproductive health education and services that prevent early pregnancy, HTIs, and sexual abuse and violence. The goal is to empower youth and young people to make healthy and respectful choices about their bodies and relationships. ARH is guided by RA 10354 and DOHAO 2013 0013. These laws recognize the rights of adolescents to access information and services that help them make informed decisions. The program also aligns with WHO and UNFPA frameworks, emphasizing adolescent empowerment, gender equality, and universal access to reproductive health care. The major issues in adolescent reproductive health include high teenage pregnancy rates, which remain a pressing concern in the Philippines. Many young people still have limited access to accurate information about fertility, contraception, and sexual health. Cultural norms and social stigma often prevent open discussion on sexuality, making it harder for adolescents to seek guidance or care. So, how can we promote adolescent reproductive health effectively? First, by strengthening comprehensive sexual education in schools and communities to build awareness and responsibility. Second, by establishing reproductive health friendly clinics and safe spaces that protect their privacy and confidentiality. Third, by promoting gender equality and parent involvement, ensuring that both boys and girls are equally informed and supported. Nurses are key advocates in adolescent reproductive health. We provide education and confidential counseling on puberty, safe sex, and family planning. We support prevention programs for STIs and early pregnancy, teaching young people to make responsible choices. Most importantly, nurses champion adolescent reproductive rights, ensuring that every youth has access to accurate information, respect, and quality care. To summarize, the Adolescent Health and Development Program, or AHDP, and the Adolescent Reproductive Health, or ARH, component promote the holistic well being of Filipino youth. These programs are built on four pillars: life skills education, accessible and confidential health services, youth participation, and supportive environments. As nurses, we play a crucial role in educating, counseling, and advocating for adolescents, guiding them toward responsible decision making and a healthy, productive future. Empowered adolescents today will lead to healthier families and stronger communities tomorrow.